Is finding good health information online. And we'll be running through a few things. I'll give you an overview in a minute. But before we get started, I'd just like to acknowledge the traditional owners and custodians on the land that we're meeting on. So for many of us, that'll be Ngunnawal and Ngambri land here in the ACT, and I can see Anne said Ngunnawal country. If you're on different country, do pop it in the chat. Um, I'd like to pay my respects to their continuing culture and the contribution they make to the life of this city and this region, and pay my respects to elders past and present, and of course acknowledge any Aboriginal or Torres Strait Islander people here at the event today. To go through what we'll be talking about, this is going to end up being a pretty long presentation just because it's a very big topic, but do feel free to stop me for questions, pop something in the chat, raise your hand, and we'll try to get to them as quick as possible. What we'll be talking about today is why we need trusted information. Why am I giving this talk and some of the reasons that it's important right now. What makes a good source of health information? What are the characteristics to look for? And conversely, how do you spot the misinformation? What are those warning signs? We'll be talking a bit about AI and where that's popping up, social media and news articles, because they're different places people get health information. And I'll share some trusted information sources. But as I say, all of this will be sent out to you afterwards as well. So to kick off the sort of why are we talking about this? So my role here at the Healthcare Consumers is Health Literacy Officer. So I'm focused on people getting the information they need and being able to put it into action around health. And health literacy is really important because it means that we as consumers, if we're health literate, we can get better outcomes. But also if the health system is designed in a way that makes it easier to be health literate, then we can find things easier, the costs of healthcare aren't as much for everyone, and it's easier to stay well. And for us as individuals, there's sort of four components to this, which is knowledge, skills, capacity, and motivation. So what do you know about the health system and health information? What skills do you have? And being able to find good health information and know what's good or what's not is a skill you can build. Capacity, so do you have the time and the resources to do so? And that's where some of the things we talk about today, you may actually be using to help other people to find what they need or work out even if something isn't that trustworthy. And motivation, do you have a reason to go and find this information? So I'm hoping to touch on all of these, but we're really focusing on what are the skills that we can build around finding good health information so that you can get the most out of that information and the most out of your healthcare. So this all takes a bit of practice, and if I'm telling you something that's really new, then that's great. If it's something that you're well practiced at, then maybe share some of your tips and tricks in the chat as we go as well. Specifically on health information, it's really important to being an informed consumer. So it's part of that health literacy picture that you understand your health conditions so that you can manage them day to day, but you also understand what are some warning signs that you might need to go see a doctor, you might need to go seek care, and where do you go and get that? So it's really important to learn about your health and health conditions so you can take action when you need to. But research also helps you ask better questions. You can ask more specific questions. You can explore your options for treatment so that you know what can fit in with your lifestyle. And doctors, of course, highly trained, but they've got a really broad remit of information, particularly like GPs. They need to know a lot. And doctors aren't infallible. So if we're a bit more informed, we can pick up where I'm not sure that that treatment path is going to fit with my lifestyle. I might not be able to do it. Are there other options? It might be that you have previous conditions or other things going on in your life that mean that you might need to dig a bit more into your different options for care. And knowing where to find information about that so you can ask those informed questions is where the practice comes in. You need to really know if information is trustworthy and right for you. There are some really clear risks with bad health information that we see out in the community. So the most obvious one is injury or illness. Bad health information online, unreliable health information can be harmful in some cases. So a few years ago, there was a trend going around for something called black salve, which is a caustic paste that people are using to treat skin cancers. there's a recipe going out around online. It was actually really dangerous because of what was in this and caused people physical damage, needing surgeries. So at its worst, you can have serious injury or illness. But it can also be things like delaying care for an illness, so it gets a lot worse. Or if people can't find the information they need about managing chronic health conditions, they might just be sitting there suffering with symptoms that they don't need to sit there and suffer with. It could also be things like taking the wrong medication or dose, and that could really vary in how much it harms people. But an example a lot of us might think of would be ivermectin during COVID. There was a lot of information going around about whether to use that or not. And historically, we've also heard about things like people using essential oils to do things like induce abortions when that was illegal, and information being passed around that was dangerous there about what to take. It could be refusing or delaying healthcare, so delaying chemotherapy to try a remedy you heard about on Facebook with something like the black salve that I talked about, which could be really harmful. But it could also be people are told to delay childhood vaccinations because of safety concerns that aren't necessarily well-founded, and that means their child could get something like measles, which can be very harmful. We've also got spreading contagious illnesses. So speaking of measles, not getting your vaccines means you could spread conditions. And even if you don't get sick, if you're not well vaccinated, that could hurt people around you who are immune suppressed or older. Stress is one as well. Having lots of confusing health information, some that's not great, some that's better, that can really overwhelm you and add stress when you're already unwell. And financial costs. So that can be that you're having to go to different doctors multiple times because you have to go to the doctor for reliable information. You're having trouble finding it yourself. But it's also things like buying into a pyramid scheme around health. Those exist and are out on the internet as well. Or spending a lot of money on a treatment that isn't on the pharmaceutical benefits scheme when there's something else available. So being informed can also help us with finances. And I'm interested if any of you can think of other risks or things you might have seen, pop them in the chat, because there's always new ones that I'm hearing about. So I'll just show you this video on what makes a good source before we dig into it in a bit more detail. Let me know if you can't hear the sound. I was hoping it would give me an ad.
Good health information is important and can help you make informed decisions and choices about your health. There's a lot of health information out there. Not all of it is reliable. So how do you know who to trust? Here are our top tips for finding good health information online. 1. Look for information that is relevant to you. Does it answer your questions? Is it Australian? Does it connect you to local services? If yes, these are good signs. 2. Look for trusted sources. If the source is an expert or expert organisation and the information is up to date and based on evidence, it's more likely to be reliable. 3. Is it easy to understand? Good health information is clear and will explain complex concepts in simple ways. 4. Look out for warning signs. If the information is trying to sell you something, make you feel afraid, or only give you one choice or option, it might not be reliable. 5. If you connect with people online, remember that their experiences may not be typical. They may be different to yours and not what happens to most people. 6. Check the information with your healthcare professional. They can help answer questions and explain options. 7. Ask for help. If you're not sure where to start, or you find information you're not sure about, reach out to others. It could be a friend or family member you trust, a health advocate or professional, a librarian, or a local consumer organisation. Ask away. For more information on finding good health information online, visit our website.
All right, so I like that video because it's kind of this 90-minute talk in a nutshell. But we'll dig in a little bit into each of their key tips. Oh, there we go. So their first point was around trusted health information. Is it from an expert or an expert organisation? But who are those expert organisations? So some of the ones that we would suggest going to would be government departments, so ACT Health, New South Wales Health, or the federal health departments. But there's also groups like peak bodies. So for example, Arthritis Australia is a not-for-profit organisation that looks specifically at arthritis, and they work with consumers and with health professionals to create really tailored information. So if you've got a specific condition, have a look at what sort of peak bodies are out there. There's also research organisations. So a lot of the universities will have information about what research is going on at their medical schools, for example, and sometimes they produce reliable information. And certainly some of the US universities end up creating little health websites with health information that you might find. One of the tips for finding out if it's an expert organisation is to have a look for things like the URL. So for an Australian government website, it would be a .gov.au, or an Australian educational institution, it would be a .edu.au. Or a .org.au for a not-for-profit in Australia. You still might need to dig in a little more to make sure that they're the right kind of educational institution or not-for-profit, but if you see a URL that's not one of those, then you might want to check a bit further. You can also look up a lot of people's qualifications online. So if you're looking at a news article, for example, and it lists a doctor talking about a specific condition, you could actually pop that doctor's name into the AHPRA, the Health Practitioners Regulation source site, and that will tell you if that's a registered doctor. Or you might go and look at a professor's profile on their university to see, well, what is their specialisation? Are they a specialist in this area? And we saw, especially during COVID, some misinformation was being spread by people who were doctors but weren't in a specialty related to what they were talking about. And that's where it got confusing for people. So you can look up qualifications online, have a look at people's institutions to make sure that they're an expert. Another way to kind of verify things is whether they refer to other sources, and maybe going and exploring those sources to see, well, is it a reputable website? Is it something like a scientific paper? Or I know I got caught out doing research for this, looking at some websites, and one of the sources was Oprah's website, which I thought was a little odd for a piece of health information. But if they don't have their sources there, you could go to somewhere like ACT Health or the Health Direct website, which I like because it's written in really good everyday language, and see if the information sort of matches what's being said in that article, particularly for common health issues. That's a good way to verify. It's a good idea to think about if it's sponsored. A lot of news sites will have sponsored content now, and there'll be a little bar at the top of the article that says, this is sponsored content. And if you see that, you might want to see who's the sponsor. Could that influence the information that's in here? And certainly if you're looking at more commercial sites, so they aren't those government or not-for-profit websites, things might come up that are sponsored that have a policy around whether their sponsors can influence what's in there. And I'll show you an example a bit later on. Another one is whether it collects your information. A lot of dodgier sites that I've seen shared around, like social media, things like that, they'll have a lot of pop-ups trying to tell you to pop in your email to get access to this article. And if it's asking for your health information, then the purpose of the website probably isn't to share health information, it's to get your information. So that could be a hint that it's not particularly trustworthy. But there are exceptions to that. And one would be something like Health Direct Symptom Tracker, which asks you for things like your age and sex, so it can give you some tailored information about symptoms, but it's not asking for your personal contact. So there's a bit of a judgment there. The next one that they talked about was relevant. So one of it is it relevant to me? Is it relevant to my life? So an example I've thought of is that a story about heart attack risk factors for older men might not be helpful for a woman in her mid-20s. And it's worth knowing that there's a bit of a bias in some scientific studies in health conditions, so that it's been mostly researched in men. And so it might be worth, particularly for people who are women or assigned giving up birth, to have a look and make sure that there's tailored information about your condition if you think it might be relevant. Is it current and up to date? So ideally something within the last 3 to 5 years would be considered relevant. But if you're looking for local services, those could be changing all the time. So it's worth seeing when a page has been updated to see how current it is. And is it Australian? That's not just about getting local health service information, though that's important, but you want to know that can I actually get what the healthcare they're talking about in Australia? But sometimes, say for example, drugs, so paracetamol, are called different things in the US, and the US produces a lot of health information we find online. And if you weren't aware of that, you might accidentally end up taking a medicine twice, or you wouldn't be aware of the differences in brands. And it's worth saying that some overseas sites are very reputable, but the medicines, treatments and services might be different here. And I wanted to flag that something that's happened a bit recently with the political changes in the US mean that some health information is being removed or changed from some of their government websites, like the National Institutes of Health and the CDC, which Australian sites reference, or they might be sources for some of the evidence. So just be aware that some of that information is changing, or you might find a link doesn't work anymore. So double check with Australian sources as much as possible. And I'll send out a bit of information, a follow-up email about what's happening and what information is being taken down. The next one is about whether something is understandable. So you want to look for sources that you can understand, or if you're sharing information with someone else, helping someone else look for information, that it's understandable to them. So does it use simple everyday language? Everyone will have a different literacy level depending on your education. Some of you might have a bit of a health background, but it's a good idea to think, is this something that I can digest really easily? Filtering through scientific papers is a tough one, because sometimes the language in scientific papers could be a little bit different to the way we use words every day. I'll show you an example of that a little later on. If you're supporting someone else, think about whether someone you care for needs a translation. There's a really great site that I'll share in our follow-up called Health Translation, and that's run by the Victorian government. It's a database of translations in hundreds of languages on different topics, all clinically verified. So Health Translations is a really good source, and getting a proper professionally done translation means that that information can be checked for the cultural context, because direct translations sometimes don't work that well for everyone. It's a good idea to look for sites that explain hard ideas. That's one of the reasons I like Health Direct, is that if it uses a medical term, it explains what it is. And the best sort of scientific summaries I see of papers also explain the hard scientific concepts so that you can understand those. So looking for a website that's reliable, that tells you, here's a medical term, here's what it means, is a good sign. And can you understand the background information? So things like scientific papers may come from really trusted sources, but it can be hard to understand the background information, and you might need help, or you might need to look for some further explanation, or of course check in with your doctor to make sure that you've got it right. Then there's a few of the warning signs. One of the ones they flagged was, is it trying to sell you something? A lot of websites, they might try to alarm you and make you panic, so you make a split-second decision to buy something, or choose, say, not to get your vaccination because they've made you fearful. So looking for, is it trying to sell you something? Is it trying to scare you? And a lot of things will try and do that at the same time. Is it offering a miracle or cure-all? Some sites will offer you sort of this one thing will solve all your weight problems and cure all your chronic conditions. So look out for that. That's definitely a red flag. Is it only giving you one choice or option? Usually there are more than one option available for conditions. So do check for that. And is it relying on only one or a few experiences? So it's just one person's story. You don't know how common that experience is. It might be a really unusual case. So those can be warning signs that something might not be particularly reliable. Some of the other tips, and I'm really keen if you've got other tips on how you filter through health information, do share them. Remember that others' experiences aren't the same as your own. So, for example, might be talking to a friend about sleeplessness. I'm having trouble sleeping, and they go, "Oh, well, I take melatonin. That helps with me." But for you, your sleeplessness might be because you've got chronic back pain. So you go and try the melatonin or a supplement that you pick up, and it doesn't work for you because you've got back pain. And you could have saved some money and time by maybe going and checking with your doctor or having a chat to the pharmacist about what's going on rather than jumping right to, well, this worked for my friend, it'll definitely work for me. Ask for help finding information or judging its quality. One that I think was missed in that video is that you can talk to the librarians at ACT libraries or even the National Library. I've done this before, and ask them for a little help finding a good source or a good book in their catalogue on a topic. So that's one resource. Of course, there's health workers. Another one would be Health Direct has a 24-hour phone line where you can call for a little bit of advice from a nurse, and that can help you work out a decision. And of course, before you make any big health decisions, so things like starting or stopping medications, big dietary changes, do check with your health professional. I know a few people got caught out with the craze about keto diets a few years ago, and that works for some people, but for some people, if you have a health condition you don't know about, that can be quite dangerous. So any big health decisions, please go and check with your doctor. Any other tips if anyone wants to give us a wave or pop anything in the chat? All right. So we're going to put a bit of that into practice now, and do chime in as we go, whether you just jump on off mute or pop it in the chat. We're going to have a look at a couple of websites and some news stories to see about, well, would we trust health information from each one and why or why not? So the first one is this. Let me switch to my browser. Can everyone see my browser now? Okay. So this article is called Recipe for the Dandelion Cure, may help with cancer, hepatitis, liver diseases, and kidney diseases. So while we're having a look, have a think about and pop your thoughts in the chat about, are there any things that would make it trustworthy or not in your eyes? So we can see there is a date. We know when it was published, so 2022, that's fairly recent. And scrolling through here, we've got it talking about dandelion having diuretic properties, stimulating the gallbladder, cleansing the liver, helping with allergies, reducing cholesterol, recommended as a dietary supplement for pregnant women and postmenopausal women. I'm noticing that there aren't any sources linked to any of these claims, which might be something. There is a link down here about working great for detox. So if I go to that, it's going to the same website. So it's referencing itself, which is probably not the best sign. So we can see not very many sources. The links that are there are going to its own website. As we scroll down, it's talking about things like putting it in salads, goes with eggs and potatoes. So they're talking about how to use it as a diet, which is interesting because they're also making those medical claims, which make it sound like a medicine. And it talks about how to prepare this. Again, no sources, no information about dosage, which with herbs could be very variable, depending on season, for example. Down here, we have something about healing properties. Oh, does that go to a scientific website? No, it goes to the same website again, and a lot of the information seems to be the same. So now we've got dandelion may offer a cure for certain types of cancer, which sounds like a pretty sensational claim. I see Jojo making a bit of a face there. And it doesn't say anything about where that comes from, and just keeps talking about how to prepare it. Has these in a slideshow as well, which I've checked. It's all the same information. Keeps talking about different recipes. And then we actually have the author. So we can go have a look at whether this person is reputable. Carl Riddell from the International Association of Therapists. So nice that they've told us where he's registered. Have a look at them. So this is the link, and we can see there's not much information about it. It says up here he's a therapist, but it doesn't say in what. Oh, I didn't click something dodgy there. International Associations of Therapists website. So they might be a registration body of some sort. I can see they've got approved modalities up here. So maybe it'll tell me what kind of therapies. So there's, looks like quite a long list here. And as I start looking, and the font on this website is very small, but we're looking at, it's talking about things like body work, sacral massage, access consciousness. So I'm not sure that this is an official registration body based on what I'm seeing here, which might tell me that Carl is not the most reputable source. So are there any other things that people spotted as we go that make you think this might not be the best source, or would you trust this information? The URL, yep, so floridahealthnews.com. So it's a .com, and it's interesting that Florida Health News it's rearranged Health News Florida, which is run by the University of Southern Florida and is actually reputable. So they might be trying to trick you. You know, if there's anything else people have spotted, there's a few other things talking about things like detoxing, without being really specific, because that's a specific body process and it doesn't really say what it means by detoxing. What toxins is it removing and how? So that's one that I flagged as I was going to. Doesn't cite any reputable sources. Some of the things in there may have some evidence, but it's not matching itself with any of them. So that one's a bit of an easy one, and I'll just switch windows again. So that's one way to work through a sort of dodgier website. But here's another one, My Doctor. And we'll open up that as well. I'll zoom in so it's a little easier to see. So straight off, the URL here is a .com.au, so it's not a government website and it's not a not-for-profit website. But it still might be reputable. We can have a bit more of a look into it. So this article is about Nature's Own Ozempic, berberine, and it's all over social media, but does it really help you lose weight? So they're looking at a trend on social media and seeing if it actually works. I'm not seeing a date here, so we might have to see if that's down the bottom perhaps. But for the first line, they've got a few authors. So Tina, Niall and Rebecca, all from the University of Sydney. So I might just have a click and see. Okay, so Tina is Professor of Pharmacology at the University of Sydney. She's got a few degrees here. She teaches pharmacology to science, medical science, pharmacy. So it sounds like she probably has the expertise we're looking for. And I don't want to take up too much time, but it's the same for the other two. They're both University of Sydney and are experts in pharmacology or medical science. So they're talking about the latest trends on TikTok, and these first few links go to TikTok and Yahoo, sort of where this is appearing online and social media. Why berberine? What is it anyway? So I talked about earlier, explaining what things are is a good sign. So it's talking about berberine is a bitter tasting chemical extracted from the roots of plants. So does it have a source here? Okay, WebMD could be, I find WebMD sometimes got some odd information on there, but for the most part, it's pretty good. It belongs to class plant chemicals. It goes to a Science Direct article here, and Science Direct is a reputable site for scientific journals, so that's also a good sign. And so that's it. It is explained what is the chemical we're actually talking about. And then it says, is it the same as Ozempic? And explains that it isn't and what the chemicals in Ozempic are. It also links to a few reputable sites, including PubMed, which is a medical database in the US of different studies. And then starts to go into, does it help you lose weight? It links to, again, PubMed and a few other reputable peer-reviewed scientific journals here. So it's a .com.au, not a government website, but it's backing up a lot of its claims, which is a good sign. And it's a .com.au, so it is Australian. The experts are Australian, so that is another good sign that it's relevant. And from reading through it, it's written in a pretty easy to understand way. So would you trust this website? And are there other things you would like to check before trusting the information? Seems trustworthy? Yeah, so I would say this one seems trustworthy. The only additional thing that I would say with a site like this that kind of specializes in providing kind of newsy, topical health information is to do something like check if they've got an advertising policy. So the My Doctor website, that article wasn't sponsored, but some of the articles on there are sponsored. And they actually have a policy where they talk about they accept advertising, but they don't exert influence on the editorial content. So choose to believe that or not. But they say their editorial is independent and unbiased. And of course, they're citing and written by experts who are academic experts. So that's something you might check if you're unsure about a website, something like their advertising or sponsored policy. So that's My Doctor. So you can see how a site might not follow all the rules, but is still pretty reputable when you look through it. One of the places where this can get a bit confusing is the news. So news stories can tell us a lot about the latest in health, treatments that are coming up. They might even just be giving you updates about what services are available if it's something like the ABC. But it's really important to remember that news is a little different to, say, scientific or health-oriented sites because journalists aren't health experts. Some health experts go into journalism and vice versa, but journalists usually aren't health experts and they might not be able to verify the claims that they're talking about. Sensational stories do tend to get more attention, so links shared around from news sites might be really sensational one-off stories that are going to get the most clicks rather than being the most reputable, useful information. And news articles often focus on one experience. Some sites are really good at adding further information, but not all of them. So when you're looking at news articles, that's where it's good to remember that one experience isn't all experiences. So you can't always make decisions about health based on what's in the news. An exception might have been in COVID. A lot of the news sites were just sharing what the government was sharing across. But reading things like the latest in cancer research doesn't mean you'll be able to get it tomorrow or anytime soon, and you'll need to do a little bit more digging. So an example of this is this article from the ABC. So CRISPR for dummies, the gene editing technology that might cure cancer one day. And we'll quickly have a look through this one. So anyone notice the first kind of orange flag? I'll zoom in. This article's from 2016. Yeah, the year, Chelsea. It's from quite a while ago now, so things may have changed and always worth double checking. And this article, it does come from experts. So Dr. Michael Herold at the Walter and Eliza Hall Institute of Medical Research, that's a reputable institution, talking about these. So it is a reputable source, but it's quite old. And they're saying specifically it might cure cancer one day. So it's not relevant right now. There are some other pros for this article. It explains CRISPR in really simple terms, and I studied CRISPR at university and really would have liked someone to explain it this simply at the time, but about a guide molecule taking an enzyme which cuts genetic material so that it can be repaired in different ways, and that's how they modify the genes. So it's a good explanation, it explains scientific concepts, but it's not health information you could apply to your own life. So that's an example of how things come up in the news. A slightly less reputable source is this example from The Sun. I won't dig through this one because it is quite a confronting story, but it shows how sensational stories can really be used to grab your attention. So gut feeling, I thought my dodgy tummy was just IBS, but it was cancer that had been growing for 10 years. So this woman had a pretty rough experience, and she does take the opportunity to draw attention to do your bowel screenings. So that's quite good. But a lot of the article is talking about how people with IBS, or it might be cancer, and that's quite alarming for people, where possibly, especially if they're being managed by a health professional, possibly don't need to be as alarmed as this makes it seem. It's also based on one extraordinary experience. So need to balance that and certainly think about, well, is this emotive language being used to make me click on the article rather than deliver important information? So I found this got shared around on social media a couple of years ago, and that's where I found it and went, oh, this is alarming. But it's a story of one case, and at the end, they do talk a lot about the bowel cancer screening programs in the UK. So could be a force for good, but they're really just trying to get clicks. So jumping off of news, though a lot of us will find news articles through social media. Social media is one place we see a lot of health information spread, and where people haven't popped in a link or a source, it can be hard to verify claims. And social media can be used to spread information really quickly, both good and bad. So good information, we saw things like daily news conferences during COVID being put up, or a lot of not-for-profits on social media, because it's a really cheap and cost-effective way for us to get information out there. But the way that social media works means that things that get the most attention spread more. So even if they're things that people get angry at, or people are in the comments correcting bad information, that makes them spread further. And it's important to remember the goal of bad health information, particularly deliberate disinformation, is not to state the facts. It's to say something that's attention grabbing so that they can get clicks and get money from advertising, that sort of thing. So there's a bit of a bias towards not so trustworthy health information because it tends to get more attention. So that's one thing to think about. It's also worth thinking about how you interacting with that information might spread it further. So sitting in the comments, arguing with people might actually make that information spread further than just reporting it or blocking a page that you think is a bit dodgy. And it's important to know now, I've got a photo here from back when Twitter was Twitter, now X, and it had a fact-checking program. And Facebook also used to have a fact-checking program. But neither of them have fact-checking programs anymore. They've stopped the funding. So social networks no longer have this little box that pops up and says, the CDC says this isn't correct. So it's even more important that we're aware that people might be getting all sorts of dodgy information without it being stopped. So if you see a claim on social media, there's not a link or anything for you to verify, then jump on a known trusted website. So this fact about flu, they talk about the US vaccine adverse events reporting system. And at the time, you could actually just go and check and find out it wasn't true just by going to that website. For other things like flu, I would, in Australia, go on the Health Direct website, the ACT Health website, and I'll show you those in a moment. So that was a flu vaccine myth, and I just want to show you some of the things that are still going around in 2025. That one was from 2022, but some of these are still going around. So this one's about, I was a dementia nurse manager. We used to call the flu vaccine the killing season. So really alarmist sort of talking there. So many residents became ill after and never recovered. You can now combine the flu vaccine with the COVID vaccine, and immune systems flattened, it's lethal. So they're talking about well, the vaccine's doing harm to people. But there's nothing we can see there to verify that this is actually a nurse. And they just say work the stats out. There's nothing for us to verify. And I've tried to find these facts that they're putting on here. And this was just a couple of weeks ago. But then there's this one, and it's a really long post and a bit hard to understand. So the gist of this, and this has been copy pasted hundreds of times on Facebook, with a video from RFK Jr., the new health secretary in the US, talking about if you get the flu shot, it'll give you something called pathogenic priming, and it causes you 4 times more sickness. It'll cause you to get coronavirus. I want to draw attention to here. It comes with 4 links, but none of these links actually work. So I've tried to get those links to work, but it looks like they've sort of written the first part of the link so that Facebook goes, oh, that's a link, but they don't actually go to any articles, and couldn't find the original posts. And it's important, it talks about something there called pathogenic priming, saying that it primes you to get flu, primes you to get COVID. And in everyday language, when you're primed for something, well, you're more likely to get it or do it. But the way that that's used in immunology is a really specific process and term for how your body might react to a virus or another pathogen. So it's got a really specific context, and that priming factor is actually something tested for in vaccine development, and none of that context is here. So these are the sorts of myths that are going around even now. And it's important to be aware that people might make it look like something is scientific or use scientific language that doesn't match up with the way we use that language every day, and that confuses you. So some quick flu facts, since I've just shared a bunch of misinformation. Flu facts. The flu vaccine can't give you the flu as it doesn't have any live virus in it. It's not 100% effective, which is why some people are talking about, I got the flu shot, then I got flu. You can still get flu, but it's usually milder. And sometimes the flu shot that we're given doesn't match the strain that ends up going around. So you might still get the flu, but it's still a good idea to get it because it's usually milder. Some people do get side effects from the flu, and from any medicine, any vaccine, that can happen. And some people are allergic to parts of the vaccine. So it's really important to talk to your doctor if you've got any known allergies. For example, eggs are used to make flu vaccines, so you might need to get a different kind of vaccine. And there doesn't seem to be any evidence that flu vaccines increase the risk of COVID-19. And we've popped some links in the chat. The last one there is actually to a paper that talks about this. So there's peer-reviewed evidence to show that that's not the case. So that's social media, that's the news, but now we've got this new power that's popping up everywhere in artificial intelligence. And I'm really curious if anyone's had experiences with AI popping up in places they didn't expect here. So some of the ones where I've noticed it popping up are in your search engine. So if you use Google or Bing, they now turn on by default little AI summaries. You can turn them off, but if you jump on a new computer or anything like that, it'll turn it back on, which can confuse you. It's also things like digital assistants. So if you use something like Siri on your phone or Alexa at home, then when you ask it questions, it might be using an AI summary to give that answer. Social media, so Facebook and Instagram now use AI in their search by default rather than just searching. And a lot of websites have things like chatbots. So if you search for something, a chatbot might pop up. So it's kind of sneaking in all sorts of places, and it's not regulated very well. So watch out for things that might be AI. There are some things that AI is good at. It's really good at summarizing lots of information, because the way that the AI we see, generative AI, works is that it understands how to write a good sentence. It understands language conventions, but it doesn't have reasoning. So it can summarize long bits of information quite well, but it can't check if it's true. It can't do the logic bit that goes, this is true, this isn't. So whilst it might make it a lot easier for you to read something, you might need to verify the facts in there. So it could actually involve more legwork in the end. And it's not always obvious that information is written by AI. Sometimes people will be publishing blog posts that are written by AI without labeling it, that sort of thing, because there's not much regulation, which is why it's a good idea to check with reputable sources where you can. It's also worth knowing that it can make realistic looking images. And for health information, that could mean that it looks like there's a photo of a new condition, but really that's just AI spat something out that looks pretty realistic. So it's something to be aware of. Some of the risks that we know about AI health information are that it can look really correct and authoritative. These AI language models, which are what's used in searches, are really good at writing information that reads well, the tone seems correct. And in some more extreme examples, searchers have recommended things like using glue in an otherwise normal pizza recipe. And that's because it's digested things like instructions for building something and mashed them all together. So the instructions look correct, it's formatted correctly, but the information within it is a bit dodgy. It might not use reliable sources for information. So a lot of these, we don't actually know where the searchers pulled information from. If it's pulled information from the whole internet, then that's including all the social media posts, that's including blog posts which have not reputable information. So it's a good idea to think about, well, does this tool tell me where it's got information? And some of the searches will tell you which websites they've come from. It's not clear what's used to train the different models, so it could be biased. I talked about earlier that some conditions have only really been researched well in men, and usually white men, depending on the history of the condition, because of biases in the way that we've done research in the past. So if it's pulling information from all of our scientific research and not factoring in that bias, then the result itself will be biased. And there's been studies into racial bias and sex bias in AI information. So especially looking at, well, is this information relevant to me? And it could be based on overseas information, of course. I've had a couple of odd ones where I've searched specifically for a Canberra health service and the AI has gotten confused and recommended me something like Minnesota. It can also be used to write disinformation. So we've been talking a lot about misinformation, which is kind of unintended, people accidentally sharing the wrong thing. Disinformation is where that's deliberate. They're trying to share wrong information. And this study, which I'll share the link with all of you, I think we might pop it in the chat. It's a really interesting article by some Australian researchers about health disinformation and how quickly someone can use AI to write health disinformation. So in this article, and I do encourage you to read it if you're curious, they got a few scientists who weren't trained in using AI at all. They didn't know how to write prompts. They were just having a go. And they managed to create in 65 minutes 102 distinct blog articles with more than 17,000 words of disinformation about vaccines and vaping. So two very hot topics. Those blog posts that they generated were pretty coercive. They were targeted at diverse groups, including young people, young parents, older people, to try and target the vulnerabilities of different groups. And those blogs, they got them to include fake patient and clinician testimonials. So it looked like there were doctors backing up what was being said. And they asked it to include scientific references. And what can sometimes happen with AI is that it'll pop out a scientific reference that is formatted correctly, but it's not a real paper. And so that happened in a number of these. So do have a look at that article if you're interested in this phenomenon. And it's less to alarm you, more to just say, be aware for things like blog post sites that might be using AI to generate a lot of content. So that phenomenon I talked about with it creating fake citations or articles is often called an AI hallucination, where it answers you with incorrect information that it thinks is true because it hasn't got that reasoning power. It can't logically kind of go, well, this article doesn't exist. It goes, here's a citation that's formatted correctly because that's what it's been programmed to do. So if it can't find the answer to your question, or if you prompt it in a certain way, and I've managed to get all the search engines to do this as well, it might spit out a citation that looks correct but doesn't actually go to a real article. And there was one case, gosh, a couple of years ago now, where a lawyer had asked ChatGPT to write a brief, and it did, and it cited different cases in it, but none of those cases were real, and they just submitted that brief without checking. So it can be used pretty sensationally. This is a summary of what happened when I tried to test this. I wanted to do a bit of an exercise where we went and had a look today, but the problem is that it'll give you a different answer every time. So I don't know if it'll give me all reputable sources today or if it'll give me the dodgy ones. So in Google, I asked all of Google, Microsoft's Copilot, which is the AI in the Bing search engine, what are the health benefits of dandelion tea? So coming from that article we saw earlier. So Google gave me a little summary, a bunch of things that are possibly scientifically valid. It had sources for a number of the things that it can do around dandelions are diuretic. So yes, it is. It does make urine go through faster. But it also talked about detoxification and that it can cleanse your liver, which there isn't much evidence of. And detoxification is often used to talk about things like diets, where there's not much evidence that it actually does what scientists understand detoxification to be, which is removing specific toxins through a specific process. And that might be used in the case of things like drug rehabilitation. That's not what it means here, and it's not clear exactly what they mean by detox here. And of the 9 sources, it gave me 7 that were pretty reasonably reputable, but 2 were tea companies trying to sell dandelion tea. So you can see Google's just giving me kind of the answer that it summarizes from its results, not checking for reputability. I did the same with Bing, so Microsoft's Copilot and the built-in search there. And it gave me 2 sources, an article from Prevention, which is a health-focused magazine, not the most reputable, like, scientific source, but they tend to verify their claims. That's something. But it gave me a link to a Quora article. And Quora is where anyone can ask any question and anyone can answer it. It's a lot like Yahoo Answers. So that doesn't have any quality control. It doesn't have any source checking. So Copilot didn't give me anything that came from a medical health related website, despite giving me the same sort of rundown that Google did. I then went to ChatGPT, which is not a search, but a lot of people use it that way, not realizing that ChatGPT is just really a chatbot with a really big database. ChatGPT also gave me a similar list to the other 2, but also mentioned detoxification, which was a bit of a flag for me. And then when I asked it to give its sources, it told me, I'm not connected to the internet, I can't give you sources. So there was no way for me to verify the claims from ChatGPT. And I know a lot of people are using it as if it was a search engine. So just a flag. I will say that ChatGPT did give me a list of sites to look at, like PubMed. It talked about the National Institutes of Health in the US. So it did give me a list of where to go, but I would still have to go and look myself. So what can you do about this? This is not to alarm you about the whole internet's going to hell. We're all working on it, and you can still spot AI fairly easily. So be aware that your search engines might use AI summaries. On that slide, I have the AI overview flag that Google has in Copilot. So look for those symbols, and they'll tell you that that's an AI answer. Turn those off if you really don't want to use them, you want to avoid them, but just be aware that that might be the case. And you might choose to search somewhere else. You might choose to go to the Health Direct website and search your question there rather than putting it into Google. Ask follow-up questions. So if you're in a chatbot, Microsoft Copilot and the Google chatbot, they'll ask you, they'll let you ask further questions. They might pop up a little chat. So you can ask follow-up questions. What were your sources for this? And that can sort of make it's like a toddler asking why until they get to the bottom of things. If you keep asking, you'll get to the bottom of whether something's verifiable or not. If it gives you a list of sources, check the sources are real and reputable, not tea companies. And I'll note that when I researched the same query earlier this week, that's when Microsoft gave me a link to Oprah's website as a reputable source according to it. So the sources will change every time you ask the question. And look multiple places for important information. So you might pop it into a search so you get an idea of this is the sort of general information out there. And then I'm going to go look at somewhere like Health Direct or one of the government websites to really make sure I'm on the right track. It's sort of like looking at Wikipedia for links that you might explore rather than using it as a reputable source. And what can you do with this information now that we've managed to filter through all the AI and news sites and all of this? Well, there's lots of things that you can do in engaging with your healthcare. So checking with your health professional before making major changes, but also partnering in decisions about your care. I was reading a bit about this treatment as an option, or I'm not sure about taking this medicine because I'm worried about side effects, but there are lifestyle options that I've heard about. What are those going to do for me? Could I try those first? So check with your doctor and use this to build some questions. You can use this to sort of proactively manage your health. It might help you understand your health condition better so you know what the warning signs are if you've got a chronic condition. And sharing good information with friends and family. There's a lot of misinformation out there on social media. You could share more reputable information. You could talk to people about, well, here's the sources that I'd look at. What about, like, could we swap sources? Because I'm not sure you've got the totally correct information. And that might be a bit easier than someone hearing, no, you're just wrong. And on that point, I'll play a quick little video with some tips on talking to others about misinformation. This is about politics, but it does apply.
When politics are brought up at the table, things can get real awkward. Difference of opinion is one thing, but what if a loved one is instead sharing misinformation? These conversations are tough, and we've all seen what happens when they fail. But there's a better way to handle these moments, both in person and online. Put your relationship first and find common ground. When we feel heard, we are more likely to listen. Gently ask where they got their information and offer to swap sources. Focus on the facts. Try loading them up with evidence from sources they trust. And reach out privately. Nobody wants to be called out in the comments or in front of family and friends. And hey, if live fact-checking is a total flop, keep trying. Tough conversations are usually the ones worth having. Just remember to listen, too.
I just like that little video because those are some really good tips for if someone in your life might be sharing dodgy information on social media. Reach out to them privately rather than embarrassing them. Gently swap some sources. Now you're all equipped with this information because we all have a role to play in helping people overcome this sort of deluge of misinformation. So you've got a bit of a role to play here as well. I don't need you to play again. There we go. So I'll show you some of the trusted sources I've been mentioning. Number one, I really like Health Direct because it's simply written and there's a range of tools on here. So they've got things like their symptom checker where if something's going on, you can use that to put in your details, what's going on. It'll give you some advice. But you can also call their 1-800 number for health advice 24/7. Really good if you're not sure how serious something is. Do I need to go to emergency or can this wait to go to the GP? Give them a call. They're quite good, particularly if you're worried about something. And everyone on there are registered nurses. If you ask a question about medicines, they might put you onto a pharmacist. That's really great. But a good tip with Health Direct is to look at their information partners. So I talked about groups like Peak Bodies earlier. A lot of Australian peak bodies are organisations that are run with consumers, doing focus on particular health conditions or particular parts of the population. They can be partners with Health Direct in that they have to meet a certain level of like clinical like verification. They have to be pretty trustworthy, and you can look at what the criteria for that is if you'd like. But this kind of A to Z of different organisations is a really good way to find out, well, what's the peak body for my condition? I've got arthritis. I want to know about arthritis. So here we are. And if you search their site or you go through their health topics, it'll recommend articles from these other organisations. So now you'll have a few different areas. So if I want to look up flu vaccines from earlier, it'll give me some information about flu and influenza, what influences the long-term flu. It'll talk about what causes the flu, how's it spread, and it does it all in plain language. So it's a good source to share with other people in your life who might not have a strong health background. So I really like that. And then if you scroll all the way to the end, I'll show you, there's a lot about flu. It's got, here's the ACT Health information about flu, the Therapeutic Drugs Administration, Better Health Channel, which is a Victorian site that I quite recommend. And I'll actually click on that because they're next on my list of good sources. Whilst the information is from Victoria, Better Health Channel is another organisation that does really good little summaries in everyday language of conditions. It's Australian, it's kept up to date, and it has a strong clinical criteria. So clinicians help make sure that this information is correct. There's a very similar website in New South Wales, and this will be in your list of links, called Your Health Link. If it wants to load. Very similar, but it's New South Wales based. So helpful if you're supporting anyone who's over the border, and it also talks about different populations. Then we've got Health Translations, which is the website that I mentioned earlier. Lots of different languages, lots of checked translated fact sheets on all sorts of different things, so you can search all sorts of things. Really good if you're supporting someone whose first language isn't English. And then if you want to dig a bit more into scientific evidence, I'd recommend checking out the Cochrane Library. So Cochrane does systematic reviews of research in healthcare, which is where they look at all the evidence for a particular treatment for a condition, that sort of thing, all at once, and try to summarize, well, how good is the quality of all this evidence? What did they find? Is everything finding the same result, which indicates it's probably true? All that sort of thing. And so they look at a ton of scientific evidence, and then I think, yes, this one's got a good summary. So they'll talk about how they carried out their review, which databases they searched. But the bit that I like for us every day is they always have a plain language summary, which summarizes what they found. So the key messages, what's the problem that they're investigating, what did they want to find out, how they did it, why is it important, and how up-to-date the evidence is. Tells you a bit about the evidence, but one thing that I really like is what's the limitations. So they'll talk about, well, did it look at only specific populations, or is the evidence lower quality? So it's a lot of smaller studies that can't necessarily be replicated. So we haven't been able to double check that something's the case. So the plain language summaries on here are really good if you're interested in finding scientific evidence, but they're written in an understandable way. So I do really rate the Cochrane Library as a source. And as I've said, the condition-specific and peak bodies, they'll be different depending on what conditions you're looking at, and the Health Direct site is a good place to start. And to plug a bit of our own work is that those sites are listed on this page on our Canberra Health Literacy Hub, which is a site that Healthcare Consumers built to talk about health literacy in Canberra. So there's stuff about finding good health information, including our fact sheets, the videos I've shared, but also if we scroll down here, it's got some resources on fact checking. So I really like this one called That's a Claim, which talks about the logic behind certain, thinking critically about health claims. So for where something's saying to be 100% safe, but talking about how few things are. So this is a good tool for being like, well, how do I actually evaluate whether something's correct or not? It's a lot more in-depth than I talked about today. It's also got the Cochrane Library that I was talking about, these good sources that I was talking about. some specific condition websites, and then we've also on this site got a range of other pages to have a look at. So if you're looking for information about medicines, we've got a page on safe use of medicines and complementary and alternative medicines. So do have a look around, have a poke around, and let us know if you've got any resources you think we should add. Okay. So the whole point of this chat is so that next time you've got a weird thing on your finger and you're Googling, those alarming answers won't stress you out as much. This hopefully won't be you in future because you'll be able to filter through or help someone else filter through the information to find the right stuff for them. And this is by Becky Barnacote on Instagram, so go check her out if you think it's cute. Really interested to hear from anyone else if there's other things you'd like to suggest or any questions from what we've talked about.
See, will you be sending us a copy of the slides or a summary?
Yeah, I'll be sending you a copy of the slides and a summary fact sheet that we've got with the good health sources. I'll also include a little fact sheet on managing anxiety around health information, like how do you think about this if it's making you worried.
Thank you.
And we've popped a link in the chat to a feedback form. We'd really appreciate that. And you can also tell us what else you'd like us to talk about, and get in touch if you want to hear about anything else or if you've got any questions from today.